So, you know, this time of year, we tend to talk about the best of 2015. Well, dermatologist Dr. Rebecca Kazin is here to talk about some of the best beauty breakthroughs, the groundbreaking new treatments and FDA approvals that have made headlines all year. And I see you have come with a lovely assistant, Joan, here.
Yes.
And you've got a syringe. What's going on? Let's talk about this treatment.
Yeah, so Radiesse has been around for a little while. It's an excellent filler that we do for kind of revolumizing and rejuvenating the face. But now we're looking at the hands because the hands can tell our age.
Yes.
And so we've moved to sometimes rejuvenating the hands with this product. It's been recently FDA approved and works exceedingly well. So the patient has already been numbing with topical numbing cream that we've wiped off, and the injection is very simple. It's done in the office. And so basically we just pinch up the skin. It's a tiny little poke, 1, 2, 3, poke.
And that quick and easy.
That quick and easy.
Now, Joan, I have to ask you, how does that feel? Is it painful? How do you feel?
Not at all.
Not at all?
Not at all.
It's really, I mean, even my most needle-phobic patients do really well with it because it's all about just helping them with the numbing, and any little bit of discomfort is extremely small.
Now, is this a one-time treatment? Do you come back for multiple treatments?
Generally, it's a one-time treatment, and it lasts for usually at least a year.
Oh, wow.
Yes,
wow.
and it builds your own collagen, which is why it can last so long.
Now, another big thing is with Selfina.
Yes.
Tell me a little bit about that.
So this was another exciting treatment, another off-the-face treatment. So cellulite is another problem that a lot of patients face, mostly women. A lot of times it's genetic. It does not have to do with your weight in general. Basically, there are these tethers that pull down between the fat, and it causes that kind of puckering. And there's been a recently approved treatment called Selfina, where we literally go in and loosen those tethers so that the skin becomes smooth. Also a one-time in-office treatment to reduce those dimples, and it's permanent.
Wow. All right, so let's talk about how much this would normally cost you. Let's start with the hand treatment that we just talked about.
Okay.
How much does that normally cost you per treatment?
Exactly. So generally depends on how devolumized the site is. So it could start off at around $450.
Okay.
Generally done, as I said, maybe once a year, sometimes lasts longer. The Selfina is a little bit more in depth, so usually starts about $1,500, but again, for a permanent cellulite treatment, that's pretty good.
It sounds good. Now, if you're a little squeamish around needles, many people are.
Yes.
What can you tell them? Are there any alternatives, or is this the best way to go?
I mean, there are topical therapies, but I have to say, I'm a pretty big baby with needles too, and I do all of these to myself. With topical numbing, it's much stronger than the EMLA and things that are out there. We actually have our own topical numbing. Literally, you will feel nothing.
Absolutely. Now, where can folks get more information about yourself and some of the treatments that are available?
Sure. Our website is skinlaser.com. Doesn't get any easier than that. And we are in Chevy Chase in DC.
All right, Joan, thank you for being with us. She's a true trooper.
She is a true trooper.
Now, tell me honestly, close your ears, doctor. Did it hurt?
No.
Did not hurt at all.
No.
All right,
Yes.
that's what we like to hear.
Yes.
Thank you guys so
All right,
much.
thank you.
Well, a major recall at Walmart